The therapist will now demonstrate how to correctly mobilize a stroke patient into side lying in bed in preparation for transfers. This demonstration shows rolling to the unaffected side. The affected hand can be identified by the white surgical glove. First, the therapist introduces herself and explains the transfer and the steps involved. The therapist begins by flexing the knee furthest away from her. In this case, the left lower limb. The therapist uses the transfer therapeutically and encourages the patient to actively participate. The next step is to bring the affected upper limb across the body. The therapist again encourages the patient to actively participate by making her aware of her left side and asks her to use her right hand to bring her left arm across her body. Take note of the therapist's body positioning and hand placement. The therapist is standing close to the bed at all times. Her right elbow supports the patient's elevated knee, with her right hand placed on the right hip. Her left hand is placed on the patient's left shoulder. The therapist then rolls the patient towards her, onto their right-hand side. Here the therapist demonstrates rolling towards the affected side. This may be necessary owing to furniture layout. Again, the therapist starts by introducing herself and explaining the transfer. If the patient is not in the center of the bed, assist the patient into a bridge position and shift the buttocks further onto the bed prior to rolling. To assist with shifting, the therapist elevates both knees, assists the patient to form a bridge and guides the pelvis across, and finally shifts the upper body to ensure alignment. The therapist ensures that the leg furthest from her remains flexed and the leg closest to her lies flat on the bed. She then abducts the affected arm out to prevent injury. She instructs the patient to bring her unaffected right arm across her body. Once again, the therapist places elbow to knee, hand to hip, and hand to shoulder. She remains close to the bed, reassures the patient of safety, and rolls the patient towards her.